I'm glad you're here. On this channel, we simplify and break down all things medical. Thank you so much for tuning in. My name is Dr. Irene Oira. On today's video, I'm going to discuss about what should be checked during your antenatal visits. Antenatal period, this is the time where women carry their pregnancy, and I'm hereby to simplify and to help you understand or know what is supposed to be checked during your antenatal visits. The first thing that will be done, and most likely to be done, is a urine test. A urine test is done to check your urine pH and whether there are any presence of urinary tract infections. These are UTIs, commonly known as UTIs. So that is done especially on the first visit and also during the subsequent visits. Another thing that is supposed to be checked and is done in all the visits is your weight. Your weight is done to check how you're faring with your pregnancy, whether your weight is on the normal range. So if it's going down or you're adding abnormally, you'll be handled accordingly. Another thing that is supposed to be checked is your blood pressure, and this is also done even in the subsequent visits. So your pressure is done to check whether your blood pressure is within the normal range, or it's below the normal range or above the normal range. So also, depending on how your blood pressure will respond, you'll be handled accordingly. Another thing that is checked, your fundal height. Fundal height, this is the measurement in centimeters mostly that is done from the pubic bone area to the highest point of your uterus. So that curvature is being checked. It's also mostly done during every visit. Sometimes the fundal height can be used to determine the stage at which you are with your pregnancy. It is also very important so that it can be noticed whether your fundal height is developing normally or abnormally. So depending on how they are going to find, you're also going to be handled accordingly. Another thing that is checked is they are going to run a blood test on you. This is mostly done during the first visit, during your second trimester, but it's not very common, and also the last visit. Blood test is mostly done to check mostly for your blood group, to check your HIV status, to check whether you have infections, to check whether there is presence of hepatitis B and C, to also check whether you have syphilis, and also to check whether you have or you are prone to be anemic. Another thing that is done is a scan, an ultrasound scan. A scan is mostly done during the first visit, the second trimester, and the last. Sometimes it can also be done during the first visit at 16 weeks, at 28 weeks, at 32 weeks, and before delivery. This could be between 36 and 40 weeks. Also a scan can be done. Another thing that is done is a Coombs test. However, it's not done on everyone. A Coombs test is mostly done if your blood results came out and you are blood group or negative. So a Coombs test is done to confirm where there are antibodies that have already started developing in your system. So if they come negative or positive, that is when now your medical personnel or your doctor will decide on whether to give you the ROGAM injection, the anti-D injection, or not. So this is basically what is done during your antenatal visits. If you have not started going for the visits and you suspect that you're pregnant, please make an effort of visiting a healthcare facility. If you were not aware of every detail that is done, that should be done on you, then you're privileged to have watched this video. I'm so glad to have shared this information with you. Tell a friend to tell a friend. Come on this channel, let's learn more and more and more. I'll see you in the next one.